Okay, my name is Valencia and I work in the staff clinic. But the staff clinic is also called the Occupational Health Clinic. Okay? Now we have promised that we're going to give the contract staff all the benefits that the clinic has got for the staff of the NMMU. We're going to give equally to the contract staff. Okay? But I have to explain to you what the staff clinic does, what the occupational health centers do. So the clinics that you see on each campus, those are the clinics for the students. Okay? The staff clinic, there's only one staff clinic, and that clinic is based at the North Campus. And it's behind the student clinic and next to the Mandela residence. Okay? So formerly what we did, we worked from there. We are only 2 staff members, it's myself and Kobus. So we used to just do the service for all the campuses. But we've decided now that we've included the contract staff, we want to do a little bit extra. Okay? So even though the clinic is based at the North Campus, we are going to come certain days, make special arrangements to come to the Mission Bell campus and to go to the Second Avenue campus as well. Okay? But I'm going to tell you a bit more of what we do at the clinic. So the service that we deliver there is a bit different to what the student clinic does. The service that we do is mainly what we are governed, what the law tells us we must do. Okay, because there's laws that tell employers what they must do to their staff. So it's called occupational health. Occupation meaning in your job. Health means your health in your job. Your health to do with your job. So that is what the law tells us. But like I said, we do a little bit more than what the law says. So the first thing I'm going to talk about now is, well, that I've just spoken about, is the occupational health part that we do. And that Kobus and I, we identify in your job what is your health problem and how your health is affecting your work and the other way around. So that's the occupational part, and that's 90% of our work. The second component of our work, or let me first tell you, like I said, that is 90% of our work, and that Kobus and I do, but we arrange that. That's all done by appointment. And these are our extension numbers. I don't know if you guys want to take it down, because you can phone us anytime. If we are not in the office, our calls are forwarded to the security. And that's for in case there's an emergency, then security knows what to do if we are not around. So the second thing that we do, and this is not by law necessary, but this is what we do a little bit of treatment of minor ailments. And that is your headaches, your backaches, your foot ache, or your tummy is upset, or you're just not feeling well. Okay, so that's the second part that we do. And later on, I'm going to talk a little bit more about how that is, how it incorporates with our main service. And then the third thing, we are also going to respond if anything happens to any of you during the day. If you collapse, if you faint, if you bleed, a huge bleed, if somebody unexpectedly is busy giving birth at work, those are the emergency services that we will respond to. And emergency cases are cases where the situation is so bad where you cannot walk to the nearest clinic, where you need to call us out. And often associated with emergencies is your ambulance service. This is the number for the ambulance service on site. But you must also be aware that the ambulance gets called out via the sisters or your manager, because there is a cost involved. Now the ambulance service, we have a dedicated ambulance service to the NMMU, and we get them at a very good price. Okay, so if you don't phone that number, if you phone any other ambulance service, they're going to charge you $3,500 to $4,000 for the call out. If you do that, are responsible for the finances, for the payment of that. Because we are not contracted to that service. We are contracted to a specific service, and that is the extension of the diploma for the ambulance service. If for any reason we are not available, security is the next point for an emergency. You would phone security and say there's an emergency, and security will know who to phone because they have the direct number for the ambulance service that's contracted to us. And this is important because when there's an IOD, and you heard now about paying your payment contribution towards the workers' compensation, in the event of an IOD with a contract staff, we will be involved, Cobus and I. It will be reported to us. We will do the necessary emergency treatment. But because your respective companies are still paying your workers' compensation fees, they will take over from there. You are not within the NMMU's workers' compensation, under our workers' compensation. So what happens after you are injured and you explain to us what happened according to your company. For example, I think there was a Supercare staff member or one of the cleaning companies, and I had to ask the supervisor, where must the ambulance take this person to? I couldn't send the person to where we would send our people to, because your companies have their own arrangements with which hospitals, which doctors, and so on. So we understand that, eh? So I said that we've got the main clinic at the North Campus clinic, at the North Campus. And there we will see people Monday to Thursday. So it's Monday, Tuesday, Wednesday between 8 and 9 for your minor ailments. Okay? And no appointments are needed. Now, although it's at North Campus, we are there for 4 days at North Campus, it doesn't mean you cannot come to North Campus. Even though you are here, you can come to North Campus on those days. But then we've also made special arrangements for the Mission Vale and the 2nd Avenue campuses. Okay, and these arrangements are, we've decided to come to Mission Vale, so we're coming out to you. It's also something we haven't done before. We're coming out to you on the 1st and the 3rd Friday of each month. To Mission Vale campus, we'll be based at the clinic. It's either myself or Quibus, between 8 and 9. So, if you guys need to see us, you can see us in that time on the 1st or the 3rd Friday. And then we have similar for 2nd Avenue, but it's the 2nd and the 4th Friday. So the minor ailments that we're talking about, you will have to pay 15 Rand at the cashiers and bring the receipt to us. Please don't bring us cash because we don't work with cash. And then you will come for your consultation. We will examine you. We normally do that extensively. But the medication we're going to give you is just for that time. And that we do with all our staff. So in other words, we don't give you lots of medication to go home with. But the services that we render, even though it costs you 15 Rand, there are some services where you don't have to pay. Okay, and those are the services you can come without paying the 15 Rand. It's your family planning. That's for new cases and for repeat cases. Your STI treatments. Your TB screening. Screening meaning if you become ill and you come to us and we suspect it's TB, we do the necessary tests and examinations. So that's the screening of TB. HIV screening and testing, and blood pressure monitoring. Those are all your free services. So I said the screening, which means monitoring and healthcare advice of treatment of chronic diseases. And your chronic diseases is any disease where you have to take a tablet every day to control the disease. That includes your blood pressure, your sugar sickness, your HIV, your TB, epilepsy, and all others where you have to take your medication every day. So for those chronic diseases, we don't offer the medication. We help you with maintaining a healthy lifestyle. We help you with diagnosing it. We help you if you have associated illnesses with those illnesses, but we do not do the treatment of those illnesses. For that, you still have to go to the public clinic.